Good afternoon, everyone, and welcome to Cook County Health Department's last CCDPH school health meeting of the 2024-2025 school year. This year went by super fast. My name is Kelly Jones, and I am a health educator senior with Cook County Department of Public Health, and I am your host and facilitator for these meetings. Thank you so much for taking the time out of your day to join us, and we constantly appreciate your continued support. Let's get started. Our agenda today, as we have some announcements and some resources that we gather to share with you. We have an update from our chronic disease unit, an update with Sheila from our communicable disease unit. Public Health Institute of Illinois has some information they'd like to share, as well as our partners with Cook County Internet Crimes Against Children's Task Force has some information they'd like to share. The purpose of our meetings are to keep you all informed and stay engaged with the school community, share resources, access valuable tools, and provide community support in any way that we can. Little housekeeping. Um, if you have any specific needs, please let us know. Keep your lines muted so that we don't not interrupt any of the participants and everyone can enjoy the meeting. And all webinars are recorded and they are uploaded to CCDPH's website along with the handouts as well as our YouTube page. We used to send out the resources afterwards, but I guess it's a good blessing to have. We got a little too big and it got more difficult to share those slides and emails. So now they are uploaded to our website. Usually about a week after our website, you can find that recording and those handouts. Few announcements. Don't forget to sign up for our monthly school health newsletter. It started a few months ago. The link is there in the slide. We'll also make sure we put that in the chat, and that way we can share even more information outside of these school meetings for anyone who is interested. Our school meetings have returned to Eventbrite, and I know that we were doing it a little differently while I was off, and people have said that they prefer the Eventbrite recurring meetings, so we returned those registrations to Eventbrite for your convenience. An announcement backed by popular demand, and we have been asked, and CCDPH exploring the possibility of hosting its annual in-person school conference. We will work on that over the summer, and hopefully we'll have some announcements when the school year is back. Stay tuned for more details, and we'll decide if we're going to continue these monthly meetings as well. So stay tuned for more information. Here's the contact information for CCDPH. If you'd like to contact our communicable disease unit with line lists, or you need to report anything, or you just have any webinar related questions, our CCDPH general website, as well as our school specific website, and then how you can reach any vaccine preventable diseases information. A few resources as for those who participated in our program prior and will reach out to me for those prescription requests. I am no longer the contact person for that. Everything has been moved to online, so you can reach that information on our website, and there's a request form there. So you can reach out. I still have some people who reach out. I'm more than happy to share them that information after the fact. Thank you, Stacy, for putting those links in the chat. And for schools who automatically have opted into the program, the Rescue Illinois program, automatically sends you out EpiPen and albuterol resources, and you can contact Naomi Soto. Let me just mute this person. You can contact Naomi Soto if you have any questions or concerns. If you are trying to receive Narcan, you can contact Denise Holman, who is our contact at CCDPH for Narcan. There is her email address listed above. In September of 2024, our CCDPH nursing unit restarted its vision and hearing screening program for children ages 3 to 5. You can do a request and contact them through the information that is listed on the slide and is also available on our website. And I get asked this quite a bit. This is the time that people are requesting these mobile vaccination resources for their summer events or for back to school time. Their calendars book up very, very quickly. So this is the time to contact them. So I put all that information on one slide as people have been asking me for that information. A few mental health resources. I'm going to sort of slide through a lot of the resources, and you can feel free to read them at their leisure. But in the interest of time, so our presenters can have time, I'm just going to pop through them really quickly. Our behavioral health unit gathered some mental health resources and put them all on one slide, as well as the 988 number, the 211 number. And this is a new resource that I was recently sent. Metropolitan Family Services has a mobile crisis line. It's 24/7. So feel free to get that information if you or someone in your school or community can use that information, as well as some NAMI support groups, as well as the Link Option Center has a 24-hour crisis living room that is available in the community. And I'll slide quickly through some of these other events. We talked about the Youth Ambassador resource coming out for the summer before, as well as some coalitions. Our partner with Public Health Institute of Illinois will talk in more detail about the action camp. Registration is ending soon. Camp starts soon, as well as some scholarship information and some more information for youth for the summer. Here's some more scholarship information and tutoring information. I just want to highlight a couple community events that are coming up soon, and you can read the rest at your leisure. Park Forest Wishton Park Neighborhood Network is having wellness event at the end of May. 100 free bags from Meals in the Meals in the Meantime will be distributed, as well as there's a large back to school event that will be happening August 2nd at St. Mary's in Crete. Safe summer programs information, as well as a t-shirt appreciation night in the western suburbs. So I just wanted to share those information, as well as another safe community event in Harvey. I will zip through the rest of these and get through our presentation. I would like to introduce Candace Nix, who is CCDPH's new manager of community immunization, and she just wanted to introduce herself really quickly to the group before we get started. Candace, are you on?
I am. Thank you
Hi,
so much. Can you
Candace.
hear me?
I can hear you.
Great. I won't take up too much time, just a minute or so to introduce myself. I am the new manager of the Community Immunization Program at CCDPH. And while there's been so many things going on for a while around immunizations for suburban Cook County, we're now just putting all of that into a program and trying to scale that up so that we can meet the needs of the community. So, our main goal is to make sure that suburban Cook County has access to immunizations with an outbreak, whether that be measles or tuberculosis or something that's happening, and that children have access to their needed vaccines for schooling. And then we meet the needs of seasonal kind of flu and COVID outbreaks and provide vaccines for those times as well. And the other part is around education and resources. So, resources meaning, can we connect you to mobile vaccine units? Can we provide vaccines for your population? Additionally, we have educational materials, we have quick flyers, and specifically right now, since we've had a few measles cases come about in Illinois, there's information that can be sent out to anyone who's interested. We do plan a larger push to all schools on information, but if you'd like something sooner than that, please reach out to me. My information's on the screen. And really just throwing a plug out here. I do understand that it's a pretty tight timeline, but we have a partnership with IDPH where we have the ability to stand up a measles clinic before June 30th. So if anyone is interested in that for their schools or community, we are happy to work with you to set that up. It will be a complete low lift on your end, but we do know that the timing is tight. So we're also looking at doing some things in the fall as well. I will stop there. Oh, I think I lost myself. Thank you so much for having me on. And please reach out to me if you have any additional questions. Thank you.
Thank you, Candace, and welcome to the team. We are going to move along to our chronic disease update, and Keith Wynn has an update he'd like to share with you. Hi, Keith.
Hey, thank you, Kelly. How you doing? Hello, everyone. My name is Keith Wynn. I am the public health educator with the chronic disease unit at CCDPH, and I just wanted to take a little time in the agenda, very, very small time, to make an announcement about the upcoming Safe Routes to Schools grant that is be occurring this year. You can advance the slide, Kelly, or should I? Thank you. So just a little background about Safe Route to Schools. Safe Route to Schools program, or the grant, aims to make it safer and easier for students to walk and bike to school. So in Illinois, the SRTS program is primarily managed and administered through the IDOT, the Illinois Department of Transportation. The SRTS program is built on a collaborative partnership between educators, parents, students, elected officials, engineers, city planners, business and community leaders, health officials, and bicycle and pedestrian advocates who advocate for safer roads for pedestrians to walk and bike. The funding source currently for this program comes from, in Illinois, the TAP program, which is the Transportation Alternatives Program, and then the Highway Safety Improvement Program. The funding cycle. So calls for proposal will be open starting October 1st through early October 2025. There's currently around $12 million in funding that could be available to municipalities and schools throughout Illinois. And this grant is 100% funded. So there are no match dollars required for those who want to apply for this grant. You can advance the slide. Just some other little facts about Safe Routes to Schools. Facts about walking and biking. So back in the 1960s, it was reported that 50% of children walked or bike to school, while today, currently around 13% of students walk and bike. Why does SRT programs work? Well, kids who walk and bike more are naturally more physically active. They've seen a more increase in walking and bicycling to schools, and the program results in decrease in pedestrian injuries near schools. Just because, if you've outlined a safe route where students can get back and forth to school, so you've seen a decrease in traffic fatalities or incidents due to the implementation of the Safe Routes to School program. Next slide, Kelly. I'm not going to go through all of these, but some of the benefits for the Safe Routes to School are naturally you have healthier students, and we all want healthier students. You have better academic performance. So as we know, many of us know, the better health of students directly relates to better academic performance within the classroom. And lastly, I'll point out the community connectiveness, and just mean that it just gets more people out in the community off of their phones, walking and biking together in groups and doing more socialization as well. So next slide, Kelly. So I just want to provide you with some upcoming dates. This is a 3-part webinar series, and so we wanted to get this out to schools because most of these will be occurring while schools are on summer break. And so number one, part 1 of the webinar series will occur July 16th. That just kind of gives those municipalities and schools, individuals, just kind of overview of the grant. Part 2 will be occur August 20th, and they'll do kind of a walkthrough of the application. And then you have an opportunity to ask IDOT staff any questions in regards to a particular project that you're thinking about applying for. And part 3 would just simply be a live question and answer with IDOT staff. Again, and that will occur on September 17th. The links are there. So then once this is posted to our website, if you or your school district or your municipality is interested, you can register just clicking that link. Next slide, Kelly. I also included some other resources for you that was shared during the initial webinar. So listed there is recording, so you get a chance to play back and to your leisure the actual recording of the first presentation, the actual copy of the slides of the presentation. And the link is there. And there are some other additional SRTS resources through the Illinois Department of Transportation, which was shared during the initial presentation or announcement of the grant program as well. Next slide. I believe that's it for me, Kelly. Oh, I have some more. Thank you. Yes. And so these are some safe routes to schools resources. And again, please feel free to, click through these resources. They give you maybe some ideas of some some past programs that have been funded. Maybe some helpful resources to help you put together your application. Um, and so these resources can be very helpful to you. Next slide, Kelly. Okay. And that's all for me. Thank you. Just want to thank you for some time just to just to share this information with you. We are encouraging municipalities and city planners and school officials, if they are interested, please feel free to take advantage of this wonderful opportunity once again to improve the health and well-being of our young people throughout our states. So thank you, everyone. Thank you, Kelly, for allowing me to share this information.
Thank you, Keith. This is great information. If you are able, if you have it, if you could put maybe the Zoom registration in the chat for anyone that may be interested and want to sign up before the time gets away from them, that would be
Sure.
great. If there's anyone that has any questions for Keith, feel free to ask them in the chat or unmute yourself. And if there are not any questions, then we will continue on. Thank you, Keith. We will
Thank you.
continue on with our presentation with Sheila Giovanni from our Communicable Disease Unit. We'll talk to you about measles and summer illness updates. Hi, Sheila.
Hi, Kelly, and good afternoon, everyone. I'm really excited just to take a few moments of your time to talk about measles and summer illnesses. In our last presentation that we did together, I gave an in-depth overview of measles. And in that presentation, I also shared a slide with you guys that focused on a graph that stated that here are the number of cases that we have for measles, and here are all of the states on the graph that at least reported one confirmed case of measles. And in my efforts, my overall goal was to have us be prepared for our case of measles that I knew was coming for 2025 in Illinois. So next slide, Callie, please. So, oh, go back one. Okay, so thank you. So here we are. I'm sure everyone is aware now that Illinois has received their very first case of measles. The first case happened actually in Marion, Illinois. It's about 6 hours from us, and they received their first confirmed case on April the 24th. Shortly after, not even a week, on April 30th, suburban Cook County, as well as the Chicago Department of Public Health, confirmed two measles cases on the exact same day. So, with that being said, we did a joint press release with Chicago and us, and we notified the community of our two confirmed measles cases in Cook County this year so far. So at this time, as of today's date, and I'm very, very big on making sure I'm time stamping everything, we have a total of 8 confirmed cases throughout the state of Illinois. Suburban Cook County, we only have one. Cook County in general, the other case being in Chicago, that gives us 2 confirmed cases in Cook County. Currently, there's still over 1,000 plus cases in the United States of measles, and we are at more cases this time in May than we had of all of last year. So it's still a really great time to take advantage of the information that Candace shared. If your schools are needing to vaccinate students and staff alike, please take advantage of those opportunities, because while we only have one case in Cook County currently, I'm sorry, in suburban Cook County currently, um, there's definitely going to be additional cases. We're getting suspected cases and doing consultations on a daily basis. Next slide, please. So I really wanted to shift gears here after I provided the update on measles to talk a little bit about some communicable disease illnesses that often occur in the summertime. And since summer season is upon us, I just thought it would be really important to discuss the various of illnesses that are commonly accompanied with the time of the year. So with that being case, we have a lot of summer activities and environment where kids be, whether that is school, summer camps, or just partaking in summer activities like wrestling. And while these can definitely be fun and exciting times, it actually can also be a breeding ground for illnesses that can easily spread among kids. Sorry about that. That's my mobile phone. Somebody's trying to reach me. Sorry about that. So can be spread among kids enjoying their summer activities. So let's go ahead and take a couple of moments to explore some of those. So first, I just wanted to bring your attention and talk about hand, foot, and mouth disease. It actually is worldwide, so it is a very common thing that happens. We do see a lot of sporadic cases, and they are often in school and child care center settings. Oftentimes, we do see that increase in incidence of hand, foot, and mouth during the summer and the early fall. And it usually impacts the children 10 years or younger. In regards to the transmission aspect, it is considered moderately contagious. It is spread person to person through direct contact with the mouth or respiratory secretions, aerosol droplets, and feces. It is not transmitted to or from animals. While hand, foot, and mouth disease is not necessarily something that has to be reported to us, meaning Cook County Department of Public Health, it's again not considered a reportable disease. We do like to monitor these cases if it's reaching our outbreak level. So we do track and monitor the outbreaks if it is 10 or more cases within a 10-day period. We want to know about it. And also, if you're reaching out to us with incidents that you're seeing within your facilities in regards to hand, foot, and mouth, we do have some information that we can share with you guys to help mitigate that risk. Next slide, please. So in regards to hand, foot, and mouth, um, thank you, control and prevention. We just want to make sure that if you're seeing that within your facility or schools, that you are excluding children from those settings that have a fever or ulcers in the mouth and the child is drooling. It's extremely imperative to focus on frequent hand washing, especially after going to the bathroom or if you're changing diapers. Again, fecal matter is one of those modes of transmission. In children and adult alike, it's really important to make sure that you're covering your mouth and nose when sneezing and coughing. And again, we're at this age group that children love to put things in their mouth. So washing toys and other contaminated surfaces regularly throughout the day is extremely imperative when we're handling and trying to manage and the control of hand, foot, and mouth. Also, I provided a link at the bottom of the screen for you to gather additional information. Next slide, please. So I do just want to share a little bit of time and talk about gastroenteritis. Actually, what comes to mind immediately is norovirus and Shigella. So these are some of the illnesses that do occur from an acute standpoint within school and early child care facilities. We see an uptick of these cases more so in the summer. So a sudden occurrence by definition is multiple cases of vomiting and or diarrhea. A definition for vomiting is at least one time within 24 hours, and diarrhea is three or more loose stools, again, among individuals in school and early child care settings. It is also just really imperative to note that oftentimes acute gastroenteritis are viruses that tends to cause these gastrointestinal illnesses in schools and early child care settings. But bacteria and parasites can also cause diarrhea and vomiting. So again, I can't stress the importance of making sure that you're washing your hands with soap and water for at least 20 seconds and then taking other hygiene measures to protect others from this infection. So if you are seeing where there are groups of 4 or more cases within a cohort within a 24-hour period, it should be reported to us, the Cook County Department of Public Health, or your local health department, but we definitely want to know about this. Next slide, please. So this slide is a little bit busy, but I do really love the illustration, right? So we're shifting gears here and we're talking about rabies. We're having individuals where there's more outside activity. We're thinking of summer camp. We're thinking of just outdoors in general, where you very well be more will be more exposed to animals. So this slide covers a lot of different bases. The first and foremost important thing to note as the to be aware, right? So make sure that if you're seeing any wild animals, that you're not just going up and petting them or touching them. Be aware, especially if it is excessive drooling, if it is aggressive behavior, or if the animal, in my term, just seems off, you definitely want to make sure that you're aware of that. When we're thinking of rabies, there's a lot of different animals that come to mind. We're thinking of bats, we're thinking of raccoons, we're thinking of rabbits. And also we have cat and dogs on here. Whereas in Cook County, we're not necessarily seeing cases in cats and dogs, more so bats and raccoons and etc. But they are sources of rabies. So if you are been scratched or nicked and blood is available or out there, just literally make sure that you are doing your due diligence to clean that area with soap and water first and foremost, and then go seek treatment. Please go to your local emergency department. Let them know that you have been scratched or with a wild animal, and you're not sure if that animal has been vaccinated for rabies. They will assess the situation. They will provide RIG and vaccine, which is our prophylaxis treatment. It's normally 4 doses, day 0, 7, um, and 14, that they will literally take a moment to assess the situation and see if you need to receive prophylaxis for treatment. If the animal is captured, they do quarantine that animal for about 10 days, I believe, to make sure that there's no aggressive behavior or if the animal dies or shows signs and symptoms of rabies. So we just definitely wanted to make you aware that we see an uptick in cases of rabies starting in June, and it lasts all summer. Oftentimes, our biggest source are bats. So just wanted to let you guys be aware of that. Next slide, please. Always buzzing. So let's talk a little bit about rabies exposure and prevention. So if you are seeing wild animals, do not feed, touch, or adopt any of them, especially stray dogs and cats. Please do not allow your pets to roam freely. So if you have any domestic animals, please be mindful about them out and about, just roaming freely. Do not attract wild animals to your home or your yard. So if you have like bird seeds or other animal feed, please make sure you're keeping them in tight fitting lid containers. And if you have any domestic animals, please make sure that you feed pets indoors. In regards to garbage can lids, if you can make sure that they're tightly capped, that would help with like raccoons coming around late at night or just in general looking for food. And then please be mindful of boarding up any openings to your attic, your basement, your porches, and your garage. Because again, oftentimes we're investigating and seeing upticks of cases of bats within your home, and these are the avenues that they're getting at. And if you can cap your chimney with screens, that would definitely be great. And also, please encourage children to immediately tell adults if they're bitten or scratched by animals. Um, but it's also most important to make sure that you're teaching them not to approach or touch any animals that they do not know, especially in summer camps environments. And it's very imperative to make sure that all animal bites are being reported to the local animal control, because then that way they can loop in the Department of Public Health, and then we can do our investigation to see if we are needing to offer or get you in the hands of where you may need to have prophylaxis so that you do not develop any symptoms of rabies. Next slide, please. Finally, I wanted to conclude by one, wishing you guys all a very enjoyable and wonderful summer. Secondly, all of the items that was discussed today in regards to hand, foot, and mouth, measles, preventing spread of infections in schools K through 12, and also preventing norovirus at youth camps. All of the links are here available for you to utilize. So again, thank you so very much, Callie, for this time. I apologize. I did not know my phones will be going off like this. So
We
I would
couldn't hear
duly
it. It's
note
fine.
that.
No,
Oh, well,
no
good.
need.
I know I heard it and it ruffled me because I'm like, oh my God, people are really trying to reach me. I'm sure it's about measles. But nonetheless, again, thank you guys very much for your time and enjoy your summer.
Thank you so much, Sheila. We
Mhm.
always appreciate the information that you give. Enjoy your summer. It's been great working with you during these meetings. And I'd like to welcome Julio Flores, who is the Program Director of Public Health Institute of Metro Chicago. And he's going to talk about some offerings that they have for youth. Welcome, Julio.
Hi, thank you. We can start. My name is Julio Flores, pronounced he, him. I am currently the program director for the Alliance of the Public Health Institute of Metropolitan Chicago. And we can go to the next slide. And next. Thank you. PHMC, we focus on advancing health justice and strengthening public health through innovation, partnerships that align with people's strategies and resources, focusing with those that come from communities that historically have not been supported. Next slide. And we accomplish this through organization development, systems transformation, fiscal management, and program implementation. We currently have about 8 different teams within the Institute that focus on different areas of the public health umbrella. For example, we have a substance prevention team, we have HIV prevention teams, and then a reentry team. And then the Alliance, next slide. The team that I lead, we focus on promoting safety, support, and the healthy development of LGBTQ young people through the state of Illinois, and that can look like in community spaces, but also school settings. We accomplish this through advocacy, education, youth organizing, and research. Our work is focused on 4 main values. So trauma-informed, body-positive, anti-oppression, and non-punitive. And every single aspect or every single initiative that we do within the Alliance and PHMC, we ensure that we're following those 4 values. As I mentioned, we have 3 main umbrellas: policy and advocacy, that can look like um, Let's say if there's a bill that will impact negatively young people, we promote or mobilize to ensure that we are able to stop that bill or ensure that we are able to educate communities on how those bills might affect them negatively. We also have professional development that can be offered to every single person, especially supporting adults. And then youth organizing, that's where we get to interact more on a face-to-face capacity with young people. Next slide. Our advocacy work can look like as well, let's say if a young person or a family is experiencing a negative situation in a school setting or community space, then they can contact us and then we become the mediator between the family, the young person, and whoever's causing the harm. Our goal is to ensure that when we find a resolution, that it aligns with what the family and the young person has in mind. We currently are following a case management approach where we do an initial intake and then we do follow-ups as needed. And then eventually, hopefully, we get to the point where we find a resolution and we just do a follow-up every 3 or 6 months. Next slide. As I mentioned, we do a lot of advocacy work. So, for example, we have the Inclusive Curriculum Law, which went into effect in 2020. The Inclusive Curriculum Law basically states that every single public school district is able to highlight the contributions of LGBTQ people throughout history. A lot of the times, one of the concerns that districts have is about money and funding. The reality is that we have the resources and the skills to teach them how to update or upgrade their curriculum so they don't necessarily have to spend money. We're also a team that collaborates with ISB on support on creating regulations such as supporting gender and non-binary and gender conforming non-conforming students. We continue to do that work and now, and we hope that we will continue for the next 3 to 4 years. Next slide. Our professional development offerings, we have four main offerings, which is creating learning environments, supporting trans and gender expansive students, implementing the Illinois inclusive curriculum law, and the legal rights of LGBTQ young people. While we do have a sliding scale, our goal is to ensure that these resources get to as many people as possible. So we also recognize that funding might be a challenge for certain organizations or community spaces and school districts. So we would like to have those conversations. We have a very simple process where people just submit an intake form. We receive that information, we will contact them back, and then we set up a self-intake conversation. During that conversation, we focus on identifying what are the needs of the organization or school district, and then what are the things that we are able to provide. We also are able to develop specific or focus trainings. So let's say if you want to train your team on how to use proper pronouns or identities or things like that, we are able to adapt or change or create professional developments based or workshops based on the needs of the school district or the community organization. Next slide. We're also doing work on the region-wide capacity. So we officially actually go live next week with our LGBTQ Midwest Network, where we are coming together with different organizations throughout the state, throughout the region, so that way we can collaborate, research share, and ensure that we are able to build support and build community and to ensure that we support LGBTQ young people, not only in the state of Illinois, but also outside of the state of Illinois. Recognizing that we are, for lack of better words, an island that has a lot of areas that are not supportive. So we are seeing an increase of families and young people who are relocating into the state of Illinois. So we're trying to eliminate as many barriers as possible to ensure that those families and young people are as supported as possible through that whole process. Next slide. We currently are the organization that hosts all the that decentralizes all information for gender and Sexuality Alliances, so GSAs. So if you are a GSA sponsor or are interested in becoming one, you can connect with us and we can do a proper training on how to conduct your sessions, how to create your agendas, how to do outreach, and so on. We also have quarterly meetings where we invite GSA sponsors to come in and network, but most importantly, if you're experiencing a challenge, that then we can collectively find solutions that you can apply within your groups or your community space. Next slide. We also, through our youth organizing umbrella, we have opportunities for young people. So for example, we have our youth advisory board that consists of 15 young people that come from different areas of the state of Illinois. They collaborate with us during the school year, and they basically everything that we do with the Alliance goes through the youth advisory board for feedback. So that way we ensure that our practices and everything that we do is youth focused and youth center. The youth advisory board is considered to be a leadership programming, and some of the positive outcomes that we have seen is that, for example, last year, 4 of our graduating seniors went to college or their top university just based on the work that they accomplished. They were able to mention how their leadership skills have grown within that specific year, and that make them, for lack of better words, a more competitive candidate for one of those roles, one of those spaces at those universities. We have young people that have gone to New York, DC, and in Chicago. The Youth Advisory Board also meets every 2 weeks, and young people get a stipend on a monthly basis for their support. Next slide. Every January, we have our Youth Leadership Summit. So this year we hosted in Bloomington, Illinois. We saw more than between 75 and 80 young people and adults that came in to build community, learn from each other, mobilize or organize, and network. Next year, we're hoping to have it within the metro area. So if you know of any schools that might be interested in hosting the Youth Leadership Summit, we will be more than happy to have those conversations. All the programming is led by young people. So from sessions to activities to the way that we promote the event, the Youth Advisory Board takes care of that. We follow their recommendations and what is it they want to accomplish. Next slide. Then our biggest event is Action Camp, which is a 5-day camping retreat where we take LGBTQ students that come from different spaces, different areas of the state of Illinois. They're able to access youth-led workshops, activities, social events, but most importantly, build community with other LGBTQ young people and see their identities reflected. I always like to mention, for example, at the end, we always do a closing circle. Last year, we had young people that shared that it was the first time that they were around a lot of, if we can call it, older adults that are living as authentically and doing jobs that they really enjoy. And then in the opposite side, the adults that were present mentioned that they were really happy to see young people come in very shy or come in and not really wanting to participate. And then by day 2 or 3, they find a sense of belonging, community, and you see that shift. You see a young person being completely authentically and just enjoying the camp. Um, our applications close officially at the beginning of this month. However, if you have any young people or you know any young person that might be interested in attending, we do have a wait list, so I can definitely send the link. The camp is completely free for those families that don't have the means to cover the event or the access to the event. We also focus on ensuring that if a young person has challenges as far as transportation, that we are able to make arrangements to ensure that that is not a challenge. Um, yeah, next slide. This is my contact information. If you would like to join um, our monthly letters, you can email info@phimc. That way you can get all the information. And then next slide. And before, if there's any questions, I wanted to mention that we have 2 events coming up. So one is a youth health conference, which will be taking place uh, on the 31st at the UIC campus. I will add the link to the registration in the chat. The event is completely free. We are trying to ensure that young people, especially under 18, have access to this event. And then the second one is that we are collaborating with a couple that has been doing a lot of activism and ensuring that literature is provided to educators, and anyone that supports LGBTQ young people. So we have created the Read the Rainbow campaign where we are going to be sending to kids of books that have been that we have selected that represent the identities of LGBTQ young people or written by LGBTQ people. And those kids will be sent to the schools, either to GSA sponsors, counselors, administration, and so on. So I will also add that link in the chat. The QR codes that you see on the screen, one goes directly to our Instagram page where you will get a lot of the information that we do or resources. And then the other one goes directly to my LinkedIn page if you would like to connect. And with that being said, thank you for the time and the opportunity to present about our services.
You guys are super busy there, Julio. Thank you so much for taking the time out to tell us about your offerings. And you guys are offering great opportunities within the community. And we hope to continue to partner with you and continue to share your mission. Thank you so much. If there are any questions or comments or anything for Julio, feel free to put them in the chat or unmute yourself. Thank you. If there are no questions or comments, we will move on to our last presenter. I'd like to welcome Marcel Taylor, who is the Assistant State's Attorney for Cook County State's Attorney's Office. And he's going to talk about the Cook County Internet Crimes Against Children Task Force. Hi, Marcel. Thank you for joining.
Hi, I hope everyone can hear me. Can you hear me?
I can. Sound great.
Okay, great. So as she said, I am Marcel Taylor. I am an assistant state's attorney with the Cook County State's Attorney's Office. I'm specifically assigned to the Internet Crimes Against Children's Task Force, where we primarily prosecute offenses that involve people preying on children on the internet and things of that nature. Today, I want to talk a little bit about our program that we present to parents about online safety, especially considering now we are getting into the summer months where children are not going to be in school as much. They're going to spend more time on their computers, on their devices. They're going to be talking to more and more people. And we do this presentation so that parents can sort of know what to look for, how they should go about tackling this issue. We also do presentations for children of all ages. If you think that your school or your youth group may benefit from such a presentation, please don't hesitate to reach out. But with that being said, we can move on to the next slide. The first thing we always try to emphasize when we do this presentation, whether we're talking to children or adults, is that the internet itself is a good thing. It's supposed to be a good thing. You know, when we talk about the internet, it's a way that everybody communicates now. It's the way that children learn to communicate first before they learn to write letters, before they learn to talk on the phone. They learn to text and they learn to chat and they learn to, learn information from the internet. All of these things are good things. It's about monitoring it in a way that makes sure that children are protected and also not teaching children to keep themselves protected from such behavior on the internet. So if we move on to the next slide, you'll see that there's been quite a few studies when it comes to the internet. One out of two teens report being online almost constantly. The study found that another 97% that they go online at least once a day, and the time that teens spend online has gone up significantly since Pew's 2014, 2015 study. Back then, it was only 24% of teens reportedly being online. Furthermore, TikTok has established that itself is one of the top online platforms for US teens, while the share of teens who use Facebook has fallen sharply. This is one of the things that we talk about when we talk about kids are always going to be online. It's not so much how do we fight against them being online, it's how do we turn that to our advantage to making sure that kids are going to be safe. So if we were to move on, um, in this presentation, we're going to focus on giving you some information that'll help you effectively monitor children online. It'll help reduce the exploitation of children online and prevent future victimization and have the opportunity to educate your children. Basically, we're trying to reduce the exploitation and future victimization and educate children, educate adults as to how to best protect their children. If we move on, the first thing we always do is how do we teach the parent to become the trusted adult in a situation? Trusted adults are someone that the children can go to when they observe or are the victim of inappropriate conduct online. A lot of times, the trusted adult will be not necessarily a parent, but maybe the aunt, maybe the uncle, maybe the older adult brother or sister, or even the parent or, excuse me, the teacher or school administrator. When we try to engage the trusted adult, the primary thing is that we want the child to know that they're in a safe space where they can talk about things that make them uncomfortable, and how the trusted adult can go about ensuring that that child is in a safe space and that that information is properly reported to the appropriate authorities. So, if we move on, some of the common questions we often get in these situations is, when should I give my child a phone? Or how do I know what they're doing online? And how do I keep them safe? And what should I do if I suspect someone is trying to harm your child? These are all common questions that we often get from parents with the Internet Crimes Against Children's Task Force. And oftentimes we will often say, it depends, right? So, if we turn to the first question in the next slide, uh, it's not just cell phones, it's all types of personal devices. um, when we talk about whether or not it's time to give a child a cell phone or a personal device, whether that's an iPad, a tablet, or even a television in their bedroom, especially considering a lot of times these televisions now, they're smart televisions where they can go online and you can do more than just watch television. If we move on to the next slide, we actually teach that each child is going to be different, and only the parent can truly know their child best. So it's about whether or not you, as the parent, or if you're the teacher or the administrator, can you have these conversations about what are the proper boundaries for online activities. There is no set age for allowing a child to have their own phone or personal device. The decision rests solely with the parent and whether or not they believe that their child, based on the raising of their child, to determine whether or not they're mature enough to handle the responsibilities that come along with having such a communication device. So, when you're starting to have the conversation about what's going on online, you do want to have the appropriate conversation about what types of things are happening on the internet. If you think that your child is mature enough to handle the responsibilities of a personal device, you want to talk to them about the dangers that they will run into. It's not if they'll run into them, it's that they will. And if your child has access to the internet, they will encounter inappropriate content at some point. Some of that inappropriate content is going to be shared to them. Some of that inappropriate content is going to be asking them to share private information. They're going to deal with situations like online enticement, sexting, sextortion, and cyberbullying. And just so we're clear, this isn't always going to be some adult on the other end of it. Some of these activities are going to take place from the school when one child has a personal device and another child has a personal device, and this information is going to be shared with your child from another child. And it's a communication approach when it comes to other parents about what exactly is and is not appropriate for your child to be viewing or allowed to happen on their personal device. So we always tell people or tell parents, always start the conversation as early as possible. Obviously, you want to keep it as age appropriate as you can. You want to talk to them about the dangers and give them actionable steps to take once they encounter inappropriate content. You want to set clear expectations and consequences from the beginning. You want to set the expectation that you will be closely monitoring their activities, at least at the beginning, as they show that they're able to maintain responsibility. You can relax those and often and just detail your monitoring to certain times of the day or night. You want to become the trusted adult and develop that relationship so that your child knows that they can in fact come to you if they do encounter inappropriate activity online. Um, and this is an ongoing conversation. If we move on to the next slide, you want to talk to your parents about, excuse me, you want to talk to the children about what are the boundaries that are necessary. Who can your child communicate with? what technology can they use, and where can the child go online, and when can the child go online with use of this type of technology. One of the easy boundaries that we often tell parents is that children are not allowed to have their devices in their bedroom or in their bathroom. Bedrooms and bathrooms are taught to be personal spaces, and that no child can take inappropriate pictures of themselves in these personal spaces. So we often say that's one of the boundaries that you can always set up. We also have a few top tips that we can establish for you. If we move a couple of slides ahead, one of the one of the things that we often will tell parents is that start putting boundaries that there's a charging station in your home. That way, there's a set time that the device is turned off, it's placed in the charging station, and it's set there to charge overnight until the next time, until they can use it again at a certain time the next day. Charging stations are a central location, not necessarily in your bedroom, but maybe it's in the dining room or the living room. You want to make it so that it stays out of the bedroom at night and allows you access to the device while your child's asleep so that you can do that proper monitoring activity that you specifically stated that you would be doing. And you want to communicate to them that you will be doing this. Otherwise, you'll develop a distrust in your activities between the child. And that's the last thing you want when it comes to online activities. You want the children to trust you and know that there are certain boundaries that are being put up in certain situations. You also want to teach the child about privacy. You want to let them know that they must set boundaries for their own behavior online. It's a general rule of thumb that anything shared online becomes public information. That's just common knowledge at this point. Even if they believe that they're only sharing it to someone of their closest friend, not only do social media companies have access to the information, but recipients can always share that information as well. So you want to teach your child about not sharing personal information. You want them to know to protect their own passwords and utilize privacy settings for websites and apps that you may place on the phone. And you also want to learn about what can be private and what is never private on social media in any given situation. Um, One of the things parents will often ask is should they use monitoring software. Personally, not personally, but it's one of those things where you want to decide personally for your family whether or not it's appropriate tool. It can be a useful tool, but at the end of the day, it is never going to take the place of proper communication with children and monitoring of the devices. If you choose to use monitoring software, make sure that your child is aware that the monitoring software is on there so that the child is not getting the feeling that you are spying on them in some way. And the same applies to GPS monitoring. Make sure that the child is aware that you're using the software and also make sure that you're using reliable applications from reputable companies. It is possible that these apps can share information to third parties and have limited security features as well, which again goes into what is and is not private. You now are aware of where the child is, but so are many other companies that you may not want to have access to that information. Now, after the boundaries are set, you want your child to be able to come to you and talk to you if there is inappropriate content on websites. You want to warn them about what they will come across, and set expectations for how they should go about reporting that, whether it's to you or some other trusted adult, so that it can get back to you in a way that they think is fair and you think is fair. You also want to set fair consequences in the event that they have come across something or they've done something inappropriate, or they have come across something and they have not told you about it. You want to establish that they will not be in trouble for disclosing. However, there will be consequences if they don't disclose something that may be important. Um, Another top tip that we will often give is the family online safety contract. If we move forward a little bit, I think that should pop up. There we go. Um, It's something that you'll have a conversation with your child about, and it doesn't have to be this specific. This is from the Carly Ryan Foundation. You can develop your own rules with your families about how to go about keeping children safe online. You can take all of these rules, you can take none of these rules, but the fact is that you want to establish in some way how children are going to be protected online, whether it's through a contract, through verbal communication with your children, or some other activity that allows you to ensure their safety. And basically what happens is that each one of you will get a contract. You will fill out the contract as the parent, they will fill out the contract as a kid, as the child, and they will basically establish what are the rules when it comes to having a personal device, and if what are the consequences if they in fact break those rules. Um, Finally, we always talk about the types of things that parents are going to run into online so that you all are prepared for what you will see. The last thing you want is to be surprised by something and then not know how to go about dealing with it. The first thing you're always going to be dealing with is cyberbullying. Cyberbullying is exactly what it sounds like, bullying through technology like cell phones, social media sites, and online games. If we can move forward a little bit. Um, about 25% of middle and high school students have been cyberbullied. About 16% have admitted to cyberbullying others, and youth who identify as LGBTQ are more likely to be involved in both the victim as well as the bully in many ways. If we move on to the next slide, you'll see some examples of cyberbullying, whether that's sending some mean text, photoshopping, or altering pictures to embarrass someone, which is becoming more and more prevalent with the advent of artificial intelligence and creating basically images that are out of whole cloth or transposing pictures that are already online of the child in some way, posting fight videos online to embarrass the person who may have quote unquote lost the fight, or creating a fake profile to post defamatory information or images. And obviously, of course, spreading rumors and gossip or posting pictures intended to embarrass someone. Um, Even if children aren't allowed to use social media sites or cell phones, they can experience some form of cyberbullying online, whether that's talking, for example, on a video game with someone. They can be exposed to inappropriate language while chatting on video games. They can be taunted by other players or targeted by more experienced players or ignored in a lot of ways by other players and excluding them from playing. These are things that parents have often come into contact with online. And if we move forward, one of the things, cyberbullying is different from regular bullying in ways that it often spreads faster, and in-person bullying because the instant online communication that can happen. It has a wider audience because it's easier to be sent to more people as opposed to bullying that happens in one particular classroom or one particular subject in the class. And it follows the children home. There's a feeling that they can't get away from it in a lot of ways. And when that happens, it's important that children have the opportunity to talk to parents about how to go about stopping the cyberbullying from happening. If we move forward to one slide, one of the things, one more slide, please. One of the things we often hear is why don't children tell? And honestly, it runs the gamut for any number of reasons. A lot oftentimes they didn't believe they tried to tell and someone didn't believe them, so they just stopped saying it. Or a teacher saw the abuse themselves, or another adult saw the abuse and didn't do anything about it. Or they did, in fact, try to tell and they were just ignored. Furthermore, a lot of students will say that they were afraid that they would make things worse. The last thing they wanted was for the parent to come up to the school and then turns into an even bigger problem for them, and so to speak. They didn't want the offender to get in trouble and then retaliate or get the reputation that they're a snitch in some way. One of the things that we can do as adults, if you're being the trusted adult, if you move forward, is you want to communicate with them constantly. In the next slide, we talk about breaking down the barriers, and it's not a magic or private box. the computer or the technology. You want to tell them that regardless of what's going on, you can always talk to the trusted adult about the issues that they're dealing with. You want to be involved with the child in the online language that they're using. Learn what the kids are doing online and be nearby when they are online. And always do your best to manage the technology. Teach kids about the time out from technology when they're going to back away from their devices and not allowed to use them, whether that's in their bedroom after bedtime, or a lot of times there's no technology after dinner time. So a lot of times, what you will often deal with is parents who aren't able to monitor the technology because they may not be in the home at that given time. Then that may be something that you want to talk about, how best to go about monitoring that technology with your child. And you also want to communicate that technology is a privilege. It is not a right in any way. Uh, Next, we want to talk a little bit about online enticement. When it comes to online enticement, children often know the perpetrator of these types of offenses. You will often get cases, if we move forward, approximately 93% are known to the victim, only 7% are strangers. 59% are acquaintances, and 34% are family members. That's from the National Sexual Assault Hotline, as well as RAIN.org. When it comes to these types of this type of online enticement, it's important to teach the kids that they should not be engaging in any type of sexualized conversations with any adults. Child exploitation often occurs with a person the child knows rather than a stranger, and you have to teach children what is inappropriate conversations, and when they do encounter those inappropriate conversations, what they should do in that response. If we move forward to the next couple of slides, we talk about a couple of red flags that parents should be on the lookout for. If conversations get too personal too quickly online, parents or children should look out for that. If there's some type of gifts that are being given by a trusted adult or a known adult, if there's talks about taking the child away to greener pastures or excessive flattery. And often you want to keep, oftentimes adults will have inappropriate conversations about keeping the child away from their friends and families and things that they like to do. And of course, there's always the inappropriate requests that they would make, or adult conversations that they would have with the child, or demanding things from the child. Furthermore, in the next slide, we also talk about offenders who exploit children's wants or needs because they may not be have the ability to get everything that they would actually ask for from an adult. Children, and oftentimes children will have a natural curiosity when it comes to sex and sexuality, depending on their age. That is fine. What's not fine is the adult on the other end trying to exploit that. And children should know that in the event that that happens, they have someone that they can talk to. Offenders gradually Offenders gradually will show children sexual abuse material or inappropriate pornography to get them curious about sex. And in those situations, they always want to have an adult that they can come to and say that they felt uncomfortable with something. And of course, obviously, when it comes to things like blackmail, they should always have a trusted adult that they can come to. When it comes to blackmail, oftentimes you will get issues of sextortion. That is actually a major crime that is currently sweeping the country. This often involves an offender posing as a child and entering into a relationship with the child, and then the offender convinces the child to send unclothed images of themselves. And after receiving those images, the offender then blackmails the child or threatens to expose the child to, and if they don't provide more images or money to stop them from providing it. And whenever you encounter a sextortion situation, in the next slide, these are how you should respond. Do not comply with any demands. Stop responding. Report it to the app. Do not delete the account. Take screenshots. You can always utilize the Taken Down initiative that is sponsored by the National Center for Missing and Exploited Children. That's at missingkids.org. You can also report a cyber tip. That's also through the National Center for Missing and Exploited Children. That is the exact same website for reporting that. And you can always get help through that same organization when it comes to this type of sextortion. Well, moving on to the next slide. One of the things oftentimes parents will do is they will get angry with the situation because obviously we've had these conversations about inappropriate behavior online. When it comes to that situation, we always encourage parents, control your emotions. You want to report it and you want to save the evidence. You want to block, you want to unfollow, and you want to mute any of those conversations as quickly as possible. When you do have this situation arise, what you want to do is report it. That is anyone sending obscene files. If you move on to the next slide, anyone sending obscene files, anyone asking for a child to take inappropriate pictures, any type of sexualized conversations, and anyone asking to meet a child. You always want to have that information reported to the proper authorities. Well, you can contact your local police department or, if necessary, your local Internet Crimes Against Children's Task Force. If you, in that particular case, it would be my organization. We are responsible for prosecuting inappropriate actions by adults online against children. We have specially trained detectives and investigators who are responsible for investigating and prosecuting these types of online enticements. So if you have any questions, any concerns, please do not hesitate to contact us. We are at cookcountyicac at gmail.com. Feel free to email us if you would like more presentations such as this, or if you have questions, we'd be happy to help in any way we can. Like I said, my name is Marcel Taylor. I'm an assistant state's attorney with the Cook County State's Attorney's Office, and I'm available if you guys need anything from ICAC. Thank you.
Marcel, this was a fantastic presentation, and we welcome you to come back at any time. Maybe hope to have you at our in-person meeting for a more in-depth presentation. I want to thank Marcel and Julio, Sheila, Keith, and welcome to Candace for all your valuable information. Thank you all for staying on, and thank you for your continued support. Have a great summer. We will see you in the fall, and enjoy. Don't hesitate to contact us if you have any questions or concerns. We are here for the community and to support you however we can. Thank you all so much. Have a great day and be well.